What's up, guys? My last video, I was just kind of trailing on and on and on about random stuff, but now I'm actually going to get more into one topic, because I'm just that horrible of a person. And in my last video, I talked about marijuana and all this type of stuff, and I want to get more into that. So, I'm going to use businessinsider.com for the benefits of marijuana, health benefits of marijuana, and I'm going to use WebMD for health risks of marijuana. Oop. Please don't change it. Okay. So I'm going to read from Business Insider first. Um, Health benefit. It can be used to treat glaucoma. It can be used to treat and prevent the eye disease, which increases pressure in the eyeball, damaging the optic nerve and causing loss of vision. The marijuana can decrease pressure inside the eye. Number two, it may help reverse the effects of tobacco and improve lung health. There was a research that happened in 2012. It happened in the American Medical Association. Um, Tobacco smokers lost lung function over time, but marijuana users actually showed increase of lung capacity. It can help with epileptic seizures. It also decreases the symptoms of a severe seizure disorder called Dravet syndrome, which there was a thing about a 5-year-old who was using marijuana to decrease the amount of seizures that she had. She went from having 300 seizures a week to just one every 7 days. Wow. One every 7 days. 40 other children in the state are using the same strain of marijuana to treat their seizures, and it seems to be working. A chemical found in marijuana stops cancer from spreading. Stops cancer by turning off a gene called ID1. Cancer cells make more copies of this gene than non-cancerous cells, and it helps spread them through the body. Researchers studied breast cancer cells in the lab and had high expressions of ID1 and treated them with cannabis. And after treatment, the cells have decreased and were less aggressive spreaders. It may decrease anxiety. May. Medical marijuana users claim the drug helps relieve pain and suppress nausea. Two main reasons it's often used to relieve side effects of chemotherapy. Beware, higher doses may increase anxiety and make you paranoid. That's out of the question now, isn't it? That study was done in 2010 at Harvard Medical School. THC slows the progression of Alzheimer's disease. 2006 study slows the formation of amyloid plaques by blocking the enzyme in the brain that makes them. These plaques are what kill brain cells and cause Alzheimer's. The drug eases pain of multiple sclerosis. I'm trying to read the best I can. Ease painful symptoms of multiple sclerosis. Canadian Medical Association Journal in May. From a study of 30 patients. Other types of muscle spasms could be helped too. Okay. Lessens side effects from treating hepatitis C and increases treatment effectiveness. Marijuana treats inflammatory bowel diseases. Why is there a child there? Relieves arthritis discomfort. Keeps you skinny and helps your metabolism. I do that myself. Improves the symptoms of lupus and autoimmune disorder. Not really health benefit. It spurs creativity in the brain. Contrary to stoner stereotype, marijuana use actually has been known to have some positive mental effects. Notice how I do not do my research. Because I'm learning this as I'm reading. Oops. Interesting. Hey, I might start. Might be able to help with Crohn's disease. Soothes tremors for people with Parkinson's. Parkinson's is where you have almost no control of your shaking that happens in the body. Helps veterans from suffering from PTSD. Approved in some states. Protects the brain after a stroke. Wow. Might protect the brain from concussions and trauma. Stuff from the NFL. Okay. Help eliminate nightmares by interrupting the later stages of REM sleep for frequent users. Reduces some awful pain and nausea from chemo and stimulates the appetite. I'm sorry about that. It can help people trying to cut back on drinking. Much safer than alcohol. Not to say it's risk-free. It's much less addictive and doesn't cause nearly as much physical damage. Alright. Oh, jeez. And now on for WebMD. How much time is there? Oh, jeez. Let's make this quick. Alright. So this person who reviewed it is an MD, medical doctor, I think. I think that's how it is. Your body on marijuana. When you smoke pot, THC and other chemicals travel from your bloodstream to your brain. THC causes the feel-good high. Other effects you'll feel: trouble thinking and remembering. I already have that. Bloodshot eyes. I don't think I do. Cotton mouth, dry mouth. Increased appetite, or the munchies. Fast heart rate, and slowed coordination. Hey, throw a ball at me and I'll probably put my hands up 5 seconds after it hit the ground. I kid you not, that's me. Marijuana smoke is filled with many of the same chemicals as tobacco smoke, including ammonia, hydrogen, cyanide, and formaldehyde. Known to cause cancer, most users smoke pot in a joint or water pipe, so they breathe the smoke straight into their lungs. There's no proof that smoking marijuana causes lung cancer like cigarettes do, but people who smoke pot do show signs of damage and precancerous changes in their lungs. Marijuana on the brain. Brain imaging scans of heavy marijuana smokers have revealed changes in blood flow to parts of the brain involved in memory and attention. Different size and shape of the thalamus. Heavy pot smokers in studies score lower than non-users on tests, memory, attention, and learning. The more they smoked, the worse they did. Other health effects. Heavy pot smokers. Okay. Effects of smoking may be more pronounced in teenager smokers than adults because teens' brains are still developing. Regular users are more likely to be diagnosed with schizophrenia, whether they have a family history condition. Other health effects anxiety, depression, fast heart rate, increased risk of heart attack within first hours after smoking, suicidal thoughts in teens. I already have that. It's loading. Uh, Eat it instead, oh jeez. Well, that's all I can really find right at the moment, but based on the two sources that I found, they seem to they don't correspond. They say, well, this part doesn't have, it doesn't do any of the brain harm, and then this part says, oh yeah, this does do the brain harm. Uh, this doesn't do anything to your lungs. This does do something to your lungs. And it's kind of confusing to keep up with, in my opinion. But I'm kind of running out of time, and I've kept you guys long enough just by going and reading something off my computer. So have a good night, guys.